Hi, Dr. Noel Williams, Optimal Health Associates. We're going to talk about ubiquinone, better known as CoQ10, another form of it called ubiquinol. But ubiquinol and ubiquinone are pretty much bioequivalent. There was once a paper saying that ubiquinol was absorbed better, but it was all baloney. So ubiquinone, it comes from the word ubiquitous, which was a word I didn't know what it meant when I hit medical school. Everyone was using ubiquitous, not the students, but the professors. So I had to look it up, and it means everywhere. So CoQ10 is everywhere. That's why I got it named ubiquinone. It's everywhere in the body. It's in every muscle. It's in your vascular system. So what does it do? Well, number one, it makes muscles contract. It makes your smooth muscle contract, your heart muscle contract, your bladder contract, your muscles contract. Number two, it is a super potent antioxidant. Antioxidant, what the heck does that mean? It's thrown around all the time, but no one ever really, most people don't know what it means. Well, we're oxygen breathers. So oxygen is an O2. It can get more energy to it per se, and it can catch an extra electron. It becomes an O3. That extra electron on that oxygen molecule, when it hits something, causes energy to be released or inflammation to the organ, to the blood vessel wall. So ubiquinone or CoQ10 will absorb that and prevent you from getting oxidative damage from oxygen, which is normal, which is why it's so key. If you're doing radiotherapy, you need to be on CoQ10 and all this other stuff I'll go over with you if you're ever a patient. But be that as it may, CoQ10, very important stuff. The problem with CoQ10 is it's made in your liver. And so a variety of medicines, all the statin drugs, beta blockers, a lot of the antidepressants stop the formation of CoQ10. And as you lose CoQ10, you get muscle aches and pains. You increase your risk for vascular disease. It can increase your risk for hypertension because your blood vessels, CoQ10 is a vasodilator besides being an antioxidant and causing muscle contractions. So when you lose CoQ10, you can get symptoms and you can have then long-term problems from it. The other thing we talk a lot about with fish oil is it stops the formation of cholesterol potentially, and helps prevent blood vessels from getting inflamed from cholesterol. But the CoQ10 is what stops the cholesterol particle from binding to the blood vessel wall, so it stops atherogenesis. So that's why CoQ10 with fish oil is such a great combination, because one, the fish oil keeps any plaque from getting inflamed. The CoQ10 helps prevent the plaque from growing or getting worse or even depositing. So CoQ10 is super important. Once a day for low-risk patients, twice a day for high-risk patients, which are pretty rare with CoQ10 because it's so potent. One a day is fantastic. Strongly recommend for anyone with cardiovascular disease, hypertension, cholesterol problems, inflammation. Great product for you. And if you're having any muscle pain, it's a must. And always remember, if you start a medicine and you start feeling muscle aches and pains, besides statins, which are very well known for this, beta blockers, antidepressants, always have your physician check and see if it blocks CoQ10 formation, because it's a huge laundry list of meds that stop your CoQ10 from being made in the liver. So quick update on CoQ10, strongly recommend.